name's Cheyenne Thomas. I'm a nursing student. Today I'll be conducting a neurological assessment. Before we begin, can I have you verify your name and your date of birth, please?
Tiara Thomas, 7/6/1994.
Tiara Thomas. I like the last name. It's beautiful.
Thank you.
What year, do you have any allergies, Tiara?
No, I don't. Just no.
Okay. That's good news. No seasonal allergies or anything?
No.
Awesome. Okay, great. So then with that, we'll be doing a neurological assessment today. It's going to include a lot of different things. And the first thing we're going to start with is just a bunch of questions, okay?
Okay.
General assessment. Patient is an overall good hygiene female. She appears stated age. She is sitting in an upright position. She's awake. She's alert. There's no signs of obvious pain or respiratory distress. There's no tripoding or anything like that. Skin looks well perfused. There's no signs of cyanosis or pallor. When looking at her face, there's no obvious signs of drooping. She's speaking in full sentences coherently, and there's no slurring of her speech. So we're going to go ahead and continue with that. So like I said, with these questions, just answer to the best of your knowledge. If you don't know, then that's okay. Just let me know, okay?
Okay.
The first question I have, your glasses, are they for fashion or are they a prescription?
They're prescription.
Okay, good. Are you nearsighted or farsighted?
I'm nearsighted.
Okay, great. Good to know. Other than that, do you have any other medical history or issues?
No.
Okay, good. I want to ask a few things like, are you in any pain today?
No.
Good. We like to hear that.
Yeah.
Are you experiencing any numbness or tingling anywhere in your body?
No.
Okay. Have you ever experienced any unexplained numbness or tingling?
No.
Great. Have you ever had any head, neck, back injury that you were hospitalized for?
A head injury when I was younger.
And then what happened?
Just got stitches.
Okay. It healed well and everything?
Yeah.
Have you ever had any seizures or anything like that after that event?
No.
Oh, awesome news. Okay. Do you have any history of things like hypertension, diabetes?
No.
What about a neurological disorder like MS?
No.
Okay, great. Do you know of any family history with any of that?
My sister had diabetes.
Okay. And does she manage that and everything?
Yeah.
Good. The other things, this is a bit of social history. So, do you smoke cigarettes or any other tobacco products?
No.
Okay. What about drink alcohol?
Yeah.
How often would you say?
Rarely, a couple times a year.
And then in those couple times, do you drink excessively or is it moderately? How would you describe that?
No, I don't drink a lot. I'm a lightweight.
Okay, fair enough.
Mm-hmm.
What about illicit drug use?
No.
Okay, great. So that's just helping us to understand different risk factors and things like that. So thank you for answering those. The next things are just based on your orientation. So sitting here, where are you at?
Reno, Nevada.
Great. What year is it?
2020, the worst year ever.
That's what I've been told many times, yes. What about the President of the United States?
Donald Trump.
All right, good job. Patient is awake and alert and oriented ×4. She's alert to self, to time, to place, and even to situation. So that's all good. Patient said she's not in any pain. She doesn't appear to be in any pain. If there was any obvious signs of pain or statements of it, we would go ahead and assess the onset, the location, the duration of the pain. We would look at the characteristics of it, the aggravating and alleviating factors. We look at any related symptoms and treatment that the patient has used, but we will continue on without those today. So to begin our assessment, what we're going to do is just go through all of your cranial nerves.
Okay.
This will involve you making funny faces at me. It'll involve saying some things, testing your balance. It'll also involve me touching your face with a cotton swab and even using my hands to feel for sensation and stuff. Does that all sound okay?
Yeah, that's fine.
If anything hurts or is uncomfortable at any point, please let me know and we will go ahead and stop and reevaluate, okay?
Okay.
So to begin, we're just going to test your facial nerve, which is cranial nerve 7. And to do that, I'm just going to have you give me a very big smile. Good. And then go ahead and frown for me. Nice frown. I like it. Lift your eyebrows all the way up to your forehead and blow your cheeks out like a pufferfish. Good job. Cranial nerve 7 is grossly intact. There's no deficit. She has no obvious signs of drooping at all, so that all looks good. The next thing we're going to go ahead and assess is going to be your facial nerve, which is what we just did, and we're going to assess your trigeminal nerve, which are kind of closely linked. The trigeminal nerve has 3 branches, so it goes to 3 different parts of your face. This is our cranial nerve 5. I do have to use a cotton swab for this.
Okay.
So to do this test, I'm going to have you close your eyes.
Okay.
And I'm going to touch a different area of your face and just let me know where it is that I'm touching, okay?
Okay.
Alright, ready?
Forehead,
Good.
cheek, chin.
Great. I'm going to come to the other side now. Ready? Alright.
Cheek, forehead, chin.
Good job. So trigeminal nerve is grossly intact. There's no deficit there. Full sensation. The next thing we're going to go ahead and do is I'm going to assess some different nerves that help in your mouth. So the first ones are going to be cranial nerve 9 and 10. That is your glossopharyngeal nerve and your vagus nerve. To do that, I have to use this bright light to look into your mouth. I'm just going to have you open wide and say ah, and I'm going to be looking at your uvula. Okay? Go ahead and say ah.
Ah.
Good job. So uvula raises to midline. There's no deviation there. Patient appears to have her tonsils removed. Have you had your tonsils removed?
And a little something else too.
And a little something else too. What else was removed?
It was something hanging off my uvula.
Yeah, there's nothing there now.
That's
She does
good.
have a small uvula, but it all is intact. Glossopharyngeal and nerve is grossly intact, as well as vagus nerve. So some more nerves we're going to go ahead and assess is your hypoglossal nerve, and this is your cranial nerve 12. To do that, the first thing I'm going to have you do is just stick your tongue out at me. Good. Tongue is midline. And now repeat these words after me. Tight,
Tight,
light,
light,
dynamite.
dynamite.
Good. Patient is able to reproduce those words without any difficulty or slurred speech. So the hypoglossal nerve is grossly intact, no deficit there. Next up, we're going to go ahead and assess your spinal accessory nerve, which is your cranial nerve 11. To do that, I have to apply some resistance to your shoulders, and I want you to lift up against it, okay?
Okay.
All right. Go ahead. Good. Now, I'm going to do the same thing with your head. So I'm going to push on one side, and I want you to push against it, okay?
Okay.
All right. Go ahead. Good. Other side. Good. Spinal accessory nerve is grossly intact, no deficit. Her strength was equal bilaterally, and she was able to withstand that pressure, so that's good. The next thing we're going to go ahead and do is assess your eyes. There's a bunch of different tests to do this. The first one we're going to do is your optic nerve, which is cranial nerve 2. For that, I'm just going to have you read a sentence out of this, and just, give it your best shot, and if you have difficulty, that's okay. So read it how you read it.
In the beginning, God created the heavens and the earth.
Perfect. Optic nerve is grossly intact. There's no deficit. She was able to read the passage perfectly without any difficulty. So that's all good. The next one is, can I have you take your glasses off for me? Unfortunately, I have to shine a bright light in your eyes, but I will try to do it as efficiently as possible, so we only have to do it once.
Okay.
And what this is testing is your cranial nerve 3, which is your oculomotor nerve.
Okay.
I'm looking for pupil reaction to the light.
Yeah.
Okay. All right, so just go ahead and look forward. Great. Okay. Good. Sorry, hope that wasn't too bad. Pupils are equal and reactive to light. They both respond accordingly and simultaneously, so that's good. Oculomotor nerve is grossly intact. The last one for your eyes that we're going to go ahead and do is the 6 cardinal fields of gaze. This is a test to test 3 different cranial nerves, and this is cranial nerve 3, which is your ocular motor, cranial nerve 4, which is your trochlear nerve, and cranial nerve 6, which is your abducens nerve.
Okay.
So for this test, I just want you to look at this object here and follow it with your eyes. Keep your head straight, just use your eyes, okay?
Okay.
All right, ready? We're looking for a thing called nystagmus, or it's commonly known as doll's eyes. Good. Last two.
Don't go too far away. I can't see it after a certain point.
Good. All right. So all those nerves are grossly intact. There's no deficit. There was no nystagmus noted. All her eye movements were smooth. So cranial nerves 3, 4, and 6 are grossly intact. So that's good. Like I said, we're looking for just your eyes to move without you trying to move them.
Okay.
But that's not present. So that's all good. Next thing we're going to do is test your sensation. So for this, I'm going to go ahead and just put my hands all the way down your arms and down your legs.
Okay.
And I just need you to tell me if you feel it or not.
Okay.
So I'm going to start with your upper extremities here. You feel it?
Feels good.
All right. And then now I'm going to use your legs. Go ahead. Yep.
Yep, feels good.
Okay. So sensation is grossly intact. No deficit there. She had gross sensation in both upper and lower extremities. Next is your kinesthetic sensation. So to do that, I'm going to have you take your hands, whenever you close your eyes, and I'm going to lift your finger up or push it down just slightly.
Okay.
And I want you to tell me which I'm doing, okay?
Okay.
I'll show you an example first. Go ahead and close your eyes. This is up, that's down.
Okay.
Okay? All right, ready?
Up, up, down.
Good. I'm going to do the other hand now.
Down, up, up.
Great. I'm going to do the same thing to your toes.
Okay.
So I'm just going to have you lift your foot. Yep, just like that. Go ahead and close your eyes.
Down, down, up.
Good. Other foot.
Down, up, up.
Great. So kinesthetic sensation is intact in both the upper and lower extremities. No deficit there. The last thing, we're going to test your balance. So are you feeling like you're able to stand up today?
Oh, absolutely.
All right, good. So first thing, go ahead and stand there. Put your hands to your side and go ahead and close your eyes. This is what we call the Romberg's test. We're looking for any swaying or trying to catch yourself. Go ahead and open, which she has a negative Romberg's test. There's no drift, no sway. So that's good. The last thing that we're going to have you do is a basic heel to toe test, like a sobriety test.
Okay.
So just go ahead and take 3 steps up. And then, yep, turn around. Nice. Great, go ahead and take a seat. So that was, she was able to walk in a linear fashion. There was no stumbling, no swaying or anything like that. No trying to catch her balance. So she's got her coordination and balance on top of it. So based on my assessment, there's no concerns or nothing that needs further investigating. But do you have any questions for me?
No, thank you so much.
Well, thank you for your time, Tier.
No problem.